This is Kirk Sinclair, the hiking humanitarian, and I'm speaking to Amy Gray, who is a youth case manager at the Kansas City Free Health Clinic. And Amy, what is the Kansas City Free Health Clinic? What are some of your who do they care for and why?
The Kansas City Free Health Clinic cares for uninsured and underinsured individuals who lack access to affordable health care. We serve about 10,000 people annually throughout the community, and we have been doing so since the early 70s.
Okay, and what are some of the demographics that you're seeing in your clinic?
Recently, we've seen pretty good increase in people needing services. Our numbers are up. Our volunteers are phenomenal, but we can't reach all of the need that's in our community. We serve a minority based specifically that's pretty significant, higher than the general population for the Kansas City area. We serve anyone from 18 to as old as you get. And then we serve a specific population, an HIV positive population as well.
Okay, and where do you get the funds to do this?
We get funds from a lot of sources. A significant portion comes from donations, as well as federal grants and local United Way organizations, things like that.
And what about some of those research projects? Do you want to talk about any of them?
We do have a couple of research projects that are funded to help specific populations and to further research in the field on certain areas. We currently have, I believe, 6 different research funding streams coming through our organization to help our populations in different areas.
And how did this health clinic come about?
Back in the 70s, there was a significant portion of our population that in the Midtown area, which is where we're located, that were living on the streets and living outside of the mainstream. Some med students got together and said we need to do something to help these people, and opened up their doors in a house and started serving people. That was early 70s, and then when the HIV/AIDS crisis came about in the early 80s, mid-80s, they were kind of on the cutting edge of serving that specific population because a lot of places would not serve that population at that time. They were too afraid.
Okay, now why are you doing this?
I'm passionate about helping people who are marginalized by society, who are disenfranchised by systems, and we really see a huge population of individuals that meet that at the Free Health Clinic, and I'm just so proud to be a part of that system. There are people that have been working there 14, 15 years, and they love what they do, and I love going to work every day and being a part of it with them.
Yeah, how does you recruit some of these? You say that a lot of them are volunteers. How do you recruit some of these volunteers that are working there?
A lot of them are students, so they're getting some volunteer hours and getting some experience before they graduate and move into their full-time careers. I think most of it, though, is through word of mouth. People know that we accept volunteers and we train them, and they get to see a part of life that maybe they've never been a part of due to their upbringing, and get to see a different portion of society that they can assist with as well.
Okay, and what do you see, if anything? Do you have a crystal ball? You see anything for the future, for what's in the future for this clinic?
Well, the biggest thing, I just went to a training this week, the biggest thing is with Affordable Health Care Act being passed, it's going to change the way that we do business, and we don't know exactly what that's going to look like yet, but we're taking those steps to look at what that will look like. A lot of things are changing in 2014, so we have to look at that and what that means for our population, those that are uninsured. That will change that, and that will change how we do business most likely. So that's probably the biggest thing on the horizon for us.
Okay, well, thank you very much for sharing that, Amy. That's inspiring.
Thank you.
This is Kirk Sinclair, hiking humanitarian.